Hello friends, welcome to the class of PSM, and today we will be discussing the subject wise test of preventive and social medicine, myself Dr. Rajesh Gupta. Starting with question 1, best way to study the relationship between two variables is. The correct answer for this question is your option B, that is the scatter diagram. Now, scatter diagram, some important points which we need to remember and commonly asked in questions is, it is also known as your correlation diagram. Second important point is used to find the correlation between two quantitative variables. Now, what is the layout of a correlation or a scatter diagram? Let us try to answer this with the help of an example. Let's suppose I am plotting weight on y-axis and height of individuals on x-axis. We see that as height increases, the weight also increases. So when we plot multiple options, we get a graph like this. Some values which are scattered all around. And when we draw an imaginary line passing through it, we see that it comes out to be a nearly straight line. So what do we infer from this graph? We infer from this graph what we call as a correlation coefficient, denoted by small r. Now, what are the values for this correlation coefficient? This correlation coefficient ranges from -1 to +1. Now, what is -1 and +1 means? -1 denotes a perfect negative association. Means, let's suppose on increasing a value on x, the value on y decreases. So as the value of x increases, the value of y will decrease. So the graph what we will get is of this way. And when we are saying that perfectly positive association, we will get a graph of this way. A unit change increase in x will bring a unit change in increase in y. So this is correlation coefficient. Two questions which we have asked from this is, one, it is can be used for quantitative variables, and second is the value. It ranges from -1 to +1. Coming to second question, all are true of silicotuberculosis except the correct answer to this question is high sputum AFB positive. Question number 2, the correct answer comes out to be option A. Now friends, we all know the entity silicotuberculosis. It's an entity formed by two diseases, silicosis and tuberculosis. Silicosis is an occupational disease caused by silica dust. So silicotuberculosis means those individuals who are suffering from silicosis and have a high probability or chances, or they are having tuberculosis, the combined entity becomes silicotuberculosis. They are more susceptible actually. So what is the mechanism? Why the people who are suffering from silicosis are more prone to getting tuberculosis? Silica dust, it gets ingested by your alveolar macrophages, causing their damage, which leads to inhibiting their ability to kill bacteria. Now since the ability of macrophages gets reduced or damaged, the immunity level of a person goes down, and when immunity goes down, the person becomes more susceptible to acquiring tuberculosis infection. So it was proposed that persons who are having silicosis get infected with tuberculosis, and a combined entity silicotuberculosis was proposed. But in recent years, doubts have been raised on its association. What are factors or doubts have been raised which are compelling that silicosis and tuberculosis are two different entities and not together a same entity? Concerns. First important concern was the sputum of such patients is rarely found to be AFB positive. Second point are in women and children the disease is not seen. Third important point is when we do a post-mortem of such patients, we find no evidence of tuberculosis. And final fourth point is radiological evidence. Both show nodular fibrosis in silicosis, whereas in tuberculosis cavitation is seen. Plus in silicosis a characteristic snowstorm appearance is seen, which is a hallmark for silicosis in chest X-ray findings. Coming to the next question, your question number 3. It says about the maximum permissible level of whole body occupational exposure to ionizing radiations. The correct answer is option C, that is 5 rems per year. Now friends, very simple question, a factual question altogether, not much to be remembered, just one or two things which we need to remember here in this is ICRP. Now it is an International Commission on Radiological Protection. International Commission on Radiological Protection has laid down certain guidelines for the occupational exposure to radiations for persons who are working in such healthcare settings or for general public. Also, it has laid down certain guidelines for different organs of the body, the maximum permissible radiological exposure. So for healthcare workers, those working in such industry, it has laid down, for healthcare person engaged, it has laid down the dose of 5 rem per year. For general public, it is 0.5 rem per year. Now for organs, it has laid down for lens of eye, the dose is labeled as 15 rems per year. Whole body 5 rem per year, and for lifetime average, the dose is 1 rem per year. Next question, question number 4. In calculating RDA for a particular nutrient, 2 standard deviations are not added for. The correct answer is option C. That is energy. Now friends, before going on to this question, let us understand the concept of RDA. That is recommended dietary allowance. Now what does it mean? In simple terms, let me try to explain. It is the level of intake of a nutrient which corresponds to mean plus 2 standard deviations which cover requirement of approximately 97% of the population. When a person is consuming nutrients in recommended dietary allowances, we expect that 97% of the population is having adequate nutrient, and only approximately 2.5 to 3% of the people are not having adequate allowance. For all the nutrients, this concept is valid except for energy. Recommended dietary allowance is not good for energy, or we say kilocalorie intake. Why such thing is important? Because in terms of energy, anything in excess is undesirable. Excess is undesirable. So in cases of energy, average or mean intake is taken. Coming to next question, that is question number 5. Kazel's necklace is seen in deficiency of. The correct answer is option B, that is pellagra, vitamin B3, sorry. Question 5, the correct answer is, that is vitamin B3, also called as niacin. It is a group of B complex vitamins. Now vitamin B3 deficiency leads to a disease called as pellagra. Now what are the features of pellagra? It is characterized by four Ds commonly asked in examinations, that is diarrhea, dermatitis, dementia, which sometimes can lead to death. Other features seen in pellagra is your glossitis, stomatitis, and mental changes, which could be depression, or delirium. Now, important entity which we need to remember in this is Cazel's necklace. Now, what is this Cazel's necklace? A typical rash is present in sun exposed areas of the body, especially neck. Now, what are the characteristics of this rash? It is pigmented and scaly. So, the presence of this rash, pigmented scaly rash in the neck area, gives a finding or a look of a necklace, hence called as Cazel's necklace. A very important finding, important MCQ which is asked in examinations. Next question, that is question number 6. How much ethinyl estradiol does the new low dose oral contraceptive pill contain in micrograms? The correct answer to this is option A, that is 20. Question number 6, the correct answer is option A, that is 20 micrograms. Now here we need to discuss the composition of low dose OCP. It consists of two things. Your ethinyl estradiol, that is 20 microgram, and desogestrel containing 150 microgram. If examiner asks it is in milligram terms, it becomes 0.02 milligram and this becomes 0.15 milligram. Whereas the OCP which is approved in the RCH program, what we called as Mala N. What is the composition? It is ethinyl estradiol becomes 30 microgram or 0.03 milligram, and in place of desogestrel we have norgestrel, that is same 150 microgram. Next question, which of the following is not used as an emergency contraceptive? The correct answer for this is option A, that is your levonorgestrel intrauterine device. Answer becomes A, that is levonorgestrel IUD. Now it gives us an opportunity to discuss this question in detail as to various methods of post-coital also called as emergency contraception. First method is your IUDs. In this, copper T is used, which should be inserted within 5 days of an unprotected intercourse. Second is your hormonal methods. In hormonal methods, there are 2-3 methods. One is your levonorgestrel oral tablets, commonly being sold in the market by the name of iPills. 0.75 milligram first tablet within 72 hours of an unprotected intercourse, followed by second tablet after 12 hours of the first tablet. Second method is using your combined OCPs. Now OCPs can be again of two types, which contains high estrogen content and which contains low estrogen content. If it contains 50 microgram estrogen, that is high, then what is the regimen? 2 pills within 72 hours, followed by 2 pills after 12 hours of the first pill. And if it is again combined OCP containing low dose of estrogen, that is 30 microgram of estrogen, then the regimen becomes 4 pills within 72 hours, followed by 4 pills after 12 hours. Third method is your oral mifepristone, labeled as RU486. The dose is 10 milligrams stat within 72 hours. Friends, it's an important question which we need to remember, because again and again in 2 or 3 forms they'll ask you the dose, or they'll ask you among all these which of the following is an emergency contraception, or all except, and they'll give you all options. So you need to remember this in detail. Next question, question number 8. Under National Rural Health Mission, ASHA stands for? The correct answer is option C, that is Accredited Social Health Activist. Now under NRHM, that is National Rural Health Mission, One of the key components was to provide in each village or a community level female community level health activist called ASHA. Now some important points which we need to remember about ASHA, that is accredited social health activist, is what is the population norm? The current population norm is to have 2 ASHAs per 1000 population or 1 village. Generally, a village is composed of approximately 1000 people. Second important point is her selection criteria. She should be a woman resident of a village in which she will be serving. Age group of 25 to 45 years and minimum education up till 8th class. Now what are the roles and responsibilities of ASHA? Friends, there is a long list, but I'll try to enumerate some important roles which we need to remember and commonly asked in examinations. First is creating awareness on health issues. Second important point is providing primary medical care for minor ailments. Third is she acts as a depot holder for ORS, iron folic acid tablets, OCPs, condoms, etc. Helps in mobilizing the public for various important aspects like immunization, conduction of village health and nutrition days, etc. Next question, that is your question number 9. The best indicator for monitoring the impact of iodine deficiency disorder control program. Correct answer is option B, that is urinary iodine levels. Now what are the impact indicators which have been suggested under this program of National Iodine Deficiency Disorder Control Program? Initially it was called National Goiter Control Program, which was labeled as National Iodine Deficiency Disorder Control Program in the wake of more findings that less of iodine supplementation not only leads to goiter but also various other manifestations like mental retardation, skeletal abnormalities, etc. So in view of that, the program was expanded from just only goiter to iodine deficiency disorders. Now for any program, some indicators have been suggested to assess the impact of the program. Under National Iodine Deficiency Disorder Control Program, the impact indicators which have been suggested are: first, urinary iodine level. It is the principal indicator. Most important indicator to assess the efficiency of the program as to whether the iodine levels in urine have increased or not among the beneficiary children. Second indicator is your neonatal thyroid hormone levels. In countries where the screening program of neonatal hypothyroidism is running, as in India, neonatal TSH levels also helps in finding whether the program is running efficiently or not. Third important point is your goiter assessment, either by self-palpation or by ultrasound evaluation. The rate of goiter assessment as to enlargement of the thyroid gland, whether it is depleting or not, is assessed, and it forms a basic component of various goiter surveys which are conducted in India to find the prevalence of goiter. Other indicator which is seen is sustainability indicators. Which we don't need to go in detail, just important is impact indicators, among which urinary iodine level forms the most important indicator, also called as the principal indicator in the program. Next question, that is question number 10. All of the following represent specific protection mode of disease prevention except. The correct answer to this is option B. That is your personal hygiene and environmental sanitation. Now before answering this question, let us go into some basics as to what different levels of prevention mean. There are 4 levels of prevention. Primordial, primary, secondary and tertiary. Now important thing which we need to remember here is risk factor and disease. In cases of, when we talk about primordial prevention, it is prevention in the purest sense, aimed at those population in which even the risk factor has not been occurred or is not present. So the question of disease is not there. So risk factor is absent and disease is absent. Even when we talk about primary prevention, we say one step ahead, risk factor is present but disease is absent. In secondary prevention, we say the risk factor is also present and the disease has also occurred. And when we talk about tertiary prevention, we say risk factor is present, disease is also present, plus complications has also occurred, advanced stage of a disease. Now, how do we intervene in such disease or under these levels of prevention? What are the various modes of intervention? When we talk about primordial prevention, it is basically aimed at improving the health of the people. No specific intervention is required, just health education is given, which is general for all diseases. But when we talk about primary prevention, we talk about health promotion and specific protection. When we talk about secondary, we talk about early diagnosis and treatment. And we talk about tertiary, we talk about disability limitation and rehabilitation. Now the question was asking about specific protection. Now what does specific protection means in primary prevention? It talks about the risk factor is present but the disease is not present. For example, chemoprophylaxis is given to those persons who are visiting some other country where some disease is endemic, and the person starts taking the medicine beforehand because he knows the risk of contracting the disease is present but the disease has not yet occurred. For example, it is given for malaria, for meningococcal meningitis, etc. Some more examples of specific protection. Use of condoms. It helps in prevention of your RTIs, STIs and pregnancy, but the disease or pregnancy has not occurred yet. Third important aspect is your vaccination, commonly asked in examinations. It is given for a particular disease to prevent that disease. Hence, specific protection for that particular disease, but the disease has not yet occurred, but the risk is present for contracting that disease. The option which was given in the question, that is your personal hygiene and environmental sanitation, that corresponds to your primordial prevention. Coming to next question. Question number 11. Which of the following is the most logical sequence? The correct answer is option B, that is disease, impairment, disability and handicap. Now let us try to define all these things and understand it with the help of an example. According to WHO, Now, according to WHO, what does disease mean? It is defined as an abnormal condition or function of an organism that impairs its function. Now, what is impairment? It is defined as either loss or abnormality in psychological, physiological or anatomical structure or function. What does disability means? Disability means because of impairment, there is restriction or inability to perform a function that is considered normal for his age. Whereas what does handicap means? Handicap means because of disability a person faces a disadvantage in society due to disability. Now let us try to explain all these four definitions with the help of an example. Let's suppose a person meets with an accident which can be corroborated to disease. Now because of accident, he loses one of his leg or foot. Now what will happen? Because of it, he is not able to walk, and because he is not able to walk, he becomes unemployed. I hope the question is pretty clear now. It can be asked in some other ways also with some different examples, but if we know what does these four definitions of disease, impairment, disability, handicap mean, we can answer these questions with ease. No need to mug up. Question number 12. WHO criteria for high endemicity of meningococcal disease. Friends, again a factual question. The correct answer is option B, that is 0.01%. What is the WHO classification of endemicity of meningococcal disease? Low endemicity is defined as less than 2 cases per 1 lakh population per year. Moderate endemicity is defined as 2 to 10 cases per lakh population per year. high endemicity, it is defined as more than 10 cases per lakh population per year. And when do we call it as an epidemic? When more than 100 cases occur per lakh population per year. Now in the question they have asked in terms of percentages. So when we calculate percentages, when we say that 10 cases per lakh, what does it become? 0.01%. And when talk about this endemic proportions, it becomes 0.1%. The correct answer becomes option C, that is high endemicity is 0.01%. Let's learn some more important points about Neisseria meningitidis. What is the causative organism? Neisseria meningitidis. How does the disease spread? Very good. Droplet spread. What is the incubation period of the disease? It is 2 to 10 days. Now important point which we need to remember here is source of infection. Carriers of meningococcal meningitis are a more important source of infection than cases. Clinical cases just form a negligible source of fraction for sources of infection. Majority is carrier. What is the case fatality rate for meningococcal meningitis? It reaches approximately 80%. Very high case fatality rate. Next question, that is question number 13. What is the point of control in tuberculosis? The infection is. The correct answer is option A, that is less than 1% in 0 to 14 group of children. Let us solve this question. Sorry, question number 13. Correct answer is option A. Now, when do we define a control of a disease? Control of a disease includes reducing the incidence of disease, reducing the duration of the disease, reducing the effect of infection, fourth point is reducing the financial burden. Because of disease. a very important point in developing countries like India. Now, WHO definition of TB control. What parameter is used to define? It is defined as when the prevalence of natural infection in the age group of 0 to 14 years is less than 1%. Then we call as TB control according to WHO. Question number 14. A logo is given of a national health program. The question which the examiner is trying to ask is the aim of the program was to reduce the case load to or less than. The correct answer to this is option C, that is 1 per 10,000. Now, before answering this question, first we need to know which particular national health program is being signified by this logo. The logo is of National Leprosy Eradication Program. Now, in National Leprosy Control Program, which was launched initially, National Leprosy Control Program, which was launched initially in 1983, was renamed as National Leprosy Eradication Program. Now, under this program, what is the target? Target was to reduce the case load to less than 1 per 10,000 population, which has been achieved in some parts of the country, but other parts are yet to achieve it. Question number 15. All of the following are didactic method of communication except. The correct answer is option C, that is panel discussion. Now let us try to answer this question. Now there are two types of teaching learning method which are described. One is didactic and other is Socratic methods. What does didactic method means? It is a one-way method of imparting information, whereas in Socratic it is two-way method of imparting information, just one way and both ways. In didactic method, as the definition is saying, one-way method, here the information is imposed on the audience, which is not a case with Socratic method. Now, what are the examples for didactic method? Yes, lecture, TV, films, radio, newspaper. These all forms an example for didactic method, where only one way information is imparted. Whereas in Socratic method, your panel discussion, your focus group discussion, seminars, workshops, they all comes under Socratic methods. Other forms of teaching learning method which are described in text are verbal and non-verbal types of communication, formal and informal types, visual communication, and some other forms, etc. Question number 16. All are true regarding AFP surveillance except. The correct answer to this question is option D. Adequate stool specimen should be taken from 100% of AFP cases. Now, under the polio program in endgame strategy, WHO has defined certain indicators which need to be met for the successful implementation of the program. The two most important critical indicators as defined by WHO are, one is your non-polio AFP rate. We all know acute flaccid paralysis is not only caused by polio but some other disorders also, like Guillain-Barré syndrome and myeloproliferative disorders. Hence, it is seen that if a reporting of AFP cases is adequate, then the system or the program is functioning properly. Now, what is the age group under which it is seen? It is seen in children less than 15 years of age. And what is the target? Target should be more than 1 per lakh. Means in a population of 1 lakh in children less than 15 years of age, we should be reporting more than one case of non-polio AFP. Then only we can say our program is functioning properly. Second important indicator is AFP cases reported with 2 stool specimen collected in 14 days of onset of paralysis. This should be more than 80%. Means of all the cases who are reported with acute flaccid paralysis, 2 stool specimens should be collected within 14 days of onset of paralysis, and the target is given is more than 80% of such cases. In more than 80% of such cases, these stool specimens should be collected. Question number 17. Essential component of RCH program in India includes all of the following except. The correct answer to this is option C, that is reduce the under 5 mortality to half. Now under these we need to remember what are the components. Of RCH program. First is your community needs assessment approach. Second is control and prevention of RTIs and STIs. Third important feature is adolescent health. Fourth is MTP services should be available at primary health center, including what we call as safe abortion services. Fifth is your gender sensitization. And last important is involvement of your Panchayati Raj institutions, NGOs with community. Question number 18 pertains to copper T thread is visible in case of early pregnancy. What is the treatment of choice? The correct answer here is option A, that is remove copper T only. Friends, remember the question is asking for early pregnancy. Here let us try to answer this question in 3 different settings. Pregnancy with copper T in situ can be divided under 3 categories. Under first category, if women require termination of pregnancy. Second category is women desirous of pregnancy, continuation of pregnancy. What do we do in first case? We go for legally induced abortion. Whereas in the second case, we can go for again 2 things. Copper T thread are visible and copper T threads are not visible. In case copper T thread is visible, we go for just removal of IUD. Whereas in case of threads, copper T thread is not visible and the woman is desirous of continuation of a pregnancy. What do we do? We carefully examine for any complications. And if complication is found, uterus is evacuated under a broad spectrum antibiotic cover and pregnancy has to be terminated. Very important question. Pregnancy with copper T in situ, what are the different options available? Question number 19. National Family Health Survey has successfully completed. The correct answer is option D, that is 4 rounds. Now what is NFHS, National Family Health Survey? It is a large scale multi-round survey done in a sample of population throughout India. Now, till date, NFHS has successfully completed 4 rounds and currently is in the process of conduction of this 5th round. Now, what are the different time frames under which these rounds have been covered? First round was done in the year 1992 to 93. Second round was done in the year 98 1998 to 99. Third round was done in the year 2005 to 2006 and fourth round was completed in 2015 to 2016. Question number 20. In a town of 36,000 people, there are 1200 live births and 60 infant deaths. What is the IMR or infant mortality ratio? Correct answer is option A, that is 50. Let us try to solve this question. How do we define infant mortality rate? Now what is infant? Infant is children less than 1 year of age. So infant mortality rate is defined by number of infant deaths in a year divided by total live births in the same year multiply by 1000. So in the given question we have been provided they are given infant deaths are 60. Live births they have given us 1200. So infant mortality rate becomes 60 by 1200 into 1000. That is 50 per 1000 live births. Now another question which can be asked from this is, what is the current infant mortality rate? current infant mortality rate of India is 34 per thousand live births. This we need to remember. This keeps on changing every year with new data coming, so it will be updated to you accordingly. Coming to question number 21. All of the following deaths are included as cause of maternal deaths except. The correct answer is option C, that is during lactation, 8th month. Now here we need to define whom do we call as a maternal death. It is defined as death of a female while pregnant or within 42 days of termination of pregnancy. Important point which we need to remember here is due to any cause aggravated by pregnancy, but not due to accidental causes. So the question says approximately within 42 days or 6 weeks. The options were given following abortion during lactation 1st month, that is before 6 weeks. So option C, during lactation 8th month, that becomes after 6 weeks, hence the answer. And option D, that is during the last trimester due to APH, that is during pregnancy, again a maternal death. Question number 22. Commonest cause of neonatal mortality in India. Correct answer is option C, that is low birth weight. Now let us try some answer this question in some more detail. The most common cause of neonatal mortality is low birth weight and prematurity. But if both the options are given, low birth weight will be the answer. Second, if we divide this neonatal, now whom do we call as a neonate? Neonate is defined as a child less than 28 days of age. It can again be defined into two. Early neonate and late neonate. Early neonate is 0 to 7 days and late neonate is 8 to 28 days. Now, when we are classifying neonate in early and late, causes for early neonatal deaths and late neonatal deaths will also be different. That's why we have classified them. So, what is the most common cause of early neonatal mortality rate? It is prematurity and congenital anomalies. And we talk about late neonatal mortality rate. The options is most common causes infections like diarrhea and tetanus. Now question number 23 is an image based question where a mosquito has been shown and they are asking is correct the wrong statement among the vector shown in the image. From image it is clear that the particular vector shown in this image is Culex. So let us try to answer this question. The correct answer to this is option D, that is exhalate singly. What is the correct answer then? Let us see some important features of Culex. Where does Culex breed? In dirty water. Important characteristic of larva: siphon tube is present. Eggs, they are laid in clusters and not singly as given in the question. Flight range approximately 11 kilometers. Question number 24. Epidemic dropsy is caused by. The correct answer is option A, that is sanguinarine. Now let us see about epidemic dropsy caused by contamination of mustard oil with argemone oil. And what is the toxin seen in argemone oil is sanguinarine. Now what are the features? Massive edema. Edema all of the body is seen. Why? Because of loss of protein from the body in urine. Now what are the tests used to find? One is your nitric acid test and other is your paper chromatography test. Both these tests are used to find whether or not the oil is contaminated with arginine oil containing sanguinarine. If both options are given, paper chromatography test is the best test used to test whether the oil has been contaminated or not. Coming to next question, that is question number 25. Food standards in India have to achieve a minimum level of quality under. The correct answer is option D, that is PFA standards. Now let us try to answer this question. Food standards. Four standards have been specified pertaining to the quality of food available in India. First is your Codex Alimentarius. Now it is a joint FAO WHO standard for food approved for international market. Second is PFA standard, also called as Prevention of Food Adulteration Standard. Now it is the minimum standard which a food item needs to qualify for it to be perishable or ready to eat under the Prevention of Food Adulteration Act 1954. Two more standards which are available are AGMARK and BIS, Bureau of Indian Standards. Important point about both these standards is they both are voluntary standards. It is up to the manufacturer to raise his benchmark of standard up to the AGMARK or BIS standard, and it expresses the degree of excellence above PFA standards. Purely voluntary, but PFA standard is the minimum standard which all the manufacturers have to qualify for a particular food items. Question number 26. Which of the following methods is used for the estimation of chlorine demand of water? Correct answer is option B, that is your rock separators. Now, what do you mean by chlorine demand? Now, chlorine is added to water to destroy bacteria and any organic matter that needs to be oxidized for water to become fit for drinking. So, chlorine is added. Now, how do we determine what amount of chlorine is required for a particular water so that it becomes fit for drinking? That concept we call as chlorine demand, and it is calculated by amount of chlorine added minus the residual chlorine. After contact period of 1 hour. We let the chlorine stay with water for 1 hour so that all the bacteria and organic matter get oxidized, and after that the amount of chlorine that remains in the water is called residual chlorine, and when we subtract the amount of chlorine added from the residual chlorine, we get the chlorine demand of water. This particular chlorine demand is estimated by Rock separators in terms of amount of bleaching powder which contains chlorine. So bleaching powder is added to determine the chlorine demand of water. Question number 27. Which of the following diseases is not found in Lakshadweep Island? Correct answer is very good, option C, that is rabies. Friends, important thing to know about rabies that rabies is endemic all throughout India. But rabies is not present in Lakshadweep Island and Andaman and Nicobar Island, which it's a factual question. No need for any further explanation, just remember it. Question number 28. Most reliable evidence of fecal contamination of water is provided by? Correct answer is option A, that is coliform bacteria. Now, what are the reasons for choosing coliform, or we can say E. coli? What are the reasons for choosing E. coli as a indicator for fecal contamination of water? First and foremost important thing is constant presence in abundance in human intestine. It is constantly present in abundance in the human intestine, hence contamination is very easy to be detected. Second point is it is easily detected by culture methods. Third important point is long survival time in contaminated water. And fourth and important point is resistance to natural purification of water. All these 4 points make E. coli a favorable coliform for detection of fecal contamination of water. Question number 29 talks about safe disposal of mercury. The correct answer is option A, that is collect carefully and recycle. Friends, we all know mercury is a hazardous waste. Hence, proper treatment or disposal is very important to prevent contamination or pollution of water, air and soil. So important thing about this is never combine with organic waste. Never dispose mercury in sink or drains. So what do? We recycle. By carefully collecting it in recycling units. Very important, because of these things only mercury blood pressure apparatus have been phased out. Question number 30. During a disaster, rapidly classifying the injured on the basis of likelihood of the survival with prompt medical intervention is a part of. The correct answer is option B, that is triage. Friends, in the wake of a disaster or any emergency where lot of patients are coming with different types of disabilities or injuries, it becomes very important to rapidly classify these people on the basis of the extent of injuries and the likelihood of survival with prompt intervention in a short span of time. Important point here is first come first served principle is not followed in such emergencies. So triage is an important part which every health functionary or person forms a part of basic training. So what is triage? It is basically a color coded mechanism where 4 colors are used for tagging the people in triage. First is red. Now what do you mean by red color? They forms the highest priority group. Important is resuscitation should be initiated within 6 hours. Second is yellow. High priority. Resuscitation should be initiated within 24 hours. Third becomes green. Which forms low priority. They are having minor illness or ambulatory patients. And fourth is black. Least priority. These are dead or moribund patients. What other options were given in the question? They were tagging and disaster mitigation. Now what do you mean by tagging? Tagging is a procedure where during such emergencies promptly these injured people are tagged pertaining to the name, age, sex, identification numbers or telephone numbers so that proper tapping of these patients can be done and resuscitation measures could be started. In disaster mitigation, what is disaster mitigation? Disaster mitigation is mainly all the procedures or all the things which are done, which are either done to reduce the effect of a disaster or preparations which are done to cause the minimum emergencies or lessen the effect of a disaster in future things.